We're here with Paul Milaire and Oliver Tarr, and we're talking about the Immersive Clinical Experience, which is a VR simulation project within the School of Medicine. Paul, and Oliver, can you tell us a little bit about the project?
Sure, yeah. So this is what we call ICE, which stands for Immersive Clinical Experience. This is our second experience within the ICE brand, and it takes learners through an emergency department in a rural healthcare setting and goes all the way through the sort of patient case experience. Learners meet their preceptor, which is their clinical mentor. They then get to meet their patient where they interview them and ask questions. They perform physical exams with their hands, so the experience is all hand-tracked. And then they work towards forming a differential diagnosis with the help of their preceptor. The preceptor asks them questions, gives them feedback, and also gives them the opportunity to perform diagnostic tests, collect imaging with a CT scan, and then ultimately, in the end of the experience, they get a bunch of feedback on how they did in the experience.
Amazing. So this is very much an experiential learning sort of simulation.
That's the hope. Yeah, that's the hope. Yeah.
And in terms of, within a medicine program, at what point in the program would a student experience something like this?
Yeah, so the medical undergraduate program is 4 years.
Okay.
And so the first and second year are more on the side of like lecture, case-based, on-campus-based activities.
Yeah.
Third and fourth are more clinical, in situ and hospital sites and things like that. And so this is more geared towards those early first and second year learners.
Yeah.
Where they're given the opportunity with this to apply their learning in a clinical setting before they get into that clinical setting where it's a little bit more high stakes. It's quite a jump from what we hear from students. And so this is designed to prep them and give them the opportunity to practice and learn in that environment before they enter it.
Yeah, I love the mentioning of stakes. I feel like that is one of the things when I think about a simulation, being able to try things out without knowing, from like a sort of harm reduction standpoint,
Yeah.
I know in, education as well, they have to go on practicum and be in front of a classroom and having the opportunity to kind of practice those skills beforehand without potentially doing harm to someone or getting something wrong, which is really normal. But when the stakes are really high, that can be quite stressful, right? Have you been using this in the classroom yet with students, or is it still sort of testing?
Yeah, so our first experience, ICE 1, was piloted and used in curriculum for a couple years. It was really helpful during the COVID years when learners were not able to see patients in person for a number of years, and so this is where this tool really came into play. This specific experience, ICE 2, what we see on the screen here, is going to students in March.
Okay, cool.
We're still sort of working out the delivery method, but
Yeah.
the hope is to have it across the province to learners, no matter where they are, in Vancouver or on the island in the north. And then we'll, hopefully collect a lot of feedback and hear what they think of it and see if it's working and whatnot.
Cool. So I can see some headsets and I can see it on a screen as well. Is this sort of optimized for use with a headset? Or like, for example, I really struggle wearing headsets for long periods of time. I get motion sick.
Yeah.
Is it is there a browser sort of platform option, or is it sort of designed specifically for a VR experience?
Yeah, that's a good question. So right now it's optimized for the headset.
Yeah.
However, we've started to prototype a sort of multiplayer mode that we call sort of a facilitator mode.
Cool.
Where somebody on a computer can see what the learner is doing in the headset.
Right.
Maybe that's another student, maybe that's their faculty preceptor or lecturer. Ultimately, we're looking at ways to sort of bridge the connection between people in headset and people outside. So you've heard from curriculum, there's a lot of learning activities that are group-based, and it'd be good to bring people together. So that's sort of where we're looking to go next with this. How can we engage people beyond just the headset? Is it maybe headset to headset, or is it through a computer screen like the one?
Yeah, amazing.
Yeah.
And in terms of like feedback from students, has it been, you were sort of saying this is that sort of low stakes environment. Was that an appreciated component of the experience? Did it make them feel a little less anxious going into real world clinical experiences, or?
I imagine so. We didn't really get that sort of long-term perspective, unfortunately. That's something we'd love to see.
Yeah, you're really cool to find.
But one of the big pieces of feedback we heard from learners is that they want more cases. Okay, they'd love to know more. They were always asking, like, is there another one? Can I try more? So we kind of took that and some other feedback as saying they really liked this ability to be in the clinical environment and practice what they're learning in classroom and in small group-based activities, and be in those clinical environments before they get there.
Yeah.
This experience itself was designed with a lot of help from students across the years of the program, as well as a couple residents. And a big component that they wanted to see was to see the whole sort of healthcare environment when they're in the experience. So where's the patient waiting room, where's the nursing station, where's the CT scan room? So that's why we have it off to the side, to really give them that experience and see sort of what each component looks like.
Right. Yeah. I feel like it would be a really handy way of kind of demystifying that experience, especially if you're a first year student and you're trying to get an idea of what you're getting yourself into. Really. Yeah. This is amazing.
Oh, thank you.
Are you intending to sort of extend, the number of different experiences like moving forward, or?
Yeah. Hopefully. We've had some early discussions with other folks in the curriculum that are interested in applying this in different ways. So that's really interesting to us, because although we've been dabbling with this for a number of years, we're still sort of really trying to hone, where it fits in medicine and for what learning experiences. So we're hoping to experiment with some new cases and maybe some more sort of group-based activities like the multiplayer type setup, to see sort of really where it fits and where it doesn't.
Definitely. Yeah. Well, this is intensely cool. And I would, as a student, be really excited about, how this could let me apply my learning in a way that sort of felt less stressful, but also more practical, right? Especially when you don't typically get those experiences. So thank you so much for sharing. Sure, I'll come and bug you again, but this is awesome. Thank you so much.
Yeah, thank you.
Thank you, Oliver. Cheers. Thank you. Amazing.